Debbie Goodman, and this is Dr. Diego and Debbie. I'm here at the Allende Center for Regenerative Medicine and Vitality, and today we're going to be talking to Dr. Allende about stem cell therapy.
Thanks for having me, Deb.
Well, thank you for being a guest on my show because I'm getting lots of attention. I'm getting lots of questions. We'll address those another time. We'll have to do a whole show of random questions from the audience. But
Fair enough.
Today, let's talk about stem cell therapy. First of all, what is it?
All right, so let's clarify. So when people talk about stem cells, there's always confusion of what we're talking about because there's been a lot of controversy over years past about research. And in this country, when people talk about embryonic stem cells, we don't use embryonic stem cells in our medical practices. That is, in my practice and every practice, I would say across America, unless you're a research lab using embryonic tissue, we're using mesenchymal stem cells, umbilical cord stem cells. On occasion, we have the patient be a self-donor. And what are stem cells? Basically, stem cells are undifferentiated baby cells, we'll call them, that have not become any tissue yet. That means we don't know if they're going to be a kidney a cell, a liver cell, a brain cell. So we don't know what they are yet. But your body can program, basically based upon signals it's sending out, for the cell basically to express itself and differentiate into a specific cell for that organ tissue that may be damaged. When we're very young, our body's able to do very good signaling pathways to summon our cells that will come from our bone marrow in our own bodies, and they're able to go to those tissue areas and help regenerate and repair. As we age, we lose that capacity. We lose the capacity both to summon, because our signaling method or signaling pathways have weakened over time for various reasons: age, decay, toxin, super stress loads, things like that. At the same time, we also lose the ability to have very young cells to come out in massive amounts like they used to when we were much younger. And again, also in that regard, because our tissue recognizes our age, even though I'm 51, so I summon stem cells from an injury I suffered to my shoulder, and I need to have surgery. So my body's going, oh, we need to repair it, so let's send stem cells. Well, the stem cells come out saying, hey, it's day one of life, we're ready to go, just like it is on a umbilical cord stem cell. But it starts to recognize the scaffold around it and the tissue around it, and that age effect of that tissue starts to tell the cell, hey, we're a little older than you think we are. So that cell has a really defined lifespan, and it shortens rather rapidly because of that, because it doesn't have the support network around it. So that's a little background information, that as we age, we lose that ability to do so, to get regeneration, because stem cells help repair and regenerate our tissues that are damaged. Every organ in our body has regeneration capacity. Every organ, every tissue, all your skin, your eyes, your heart, your brain, everything. It just happens at a very slow pace, unless its tissues have rapid turnover, like where? Like my gut, my intestines. That turns over on a regular basis because those endothelial tissues have rapid turnover. But when you get to tissues like your heart, it'll take you 50 years to turn over the entire heart muscle's worth of cells. It does it very slow. One may argue that it was probably programmed that way because you just can't have it all happen at one time or you die. But what happens with the gut, because you have 27 feet of gut lining or intestines, you got a lot of time. You got a lot of turnover that can happen without having long-term or sudden, ramifications to your life expectancy. And so this is a process that's ongoing in our body. We use stem cells in the capacity in our office where we want to stimulate the regenerative process in a rapid way and reactivate in us as we're getting old, because we lose that capacity, right? So we use mesenchymal stem cells, umbilical cord blood. They call it different names. You get a lot of products in what they call the umbilical cord blood. They have things like, which ones that we like to use in my practice, because I like to use them for regenerating things like cartilage and ligaments and tendons and muscles. You can even get nerves, like neuron repair and regeneration, if you got the right type of stem cells. And most of those come from mesenchymal stem cells, which you can find in your bone marrow, you can find in your blood, but an overabundance of them lie in our fatty tissue. So our fat contains an enormous amount of stem cells. They call them mesenchymal, and those are fantastic because those type of cells can become just about anything you want them to become except blood cells. So they'll become things like cartilage, neurons, it could be muscle, a whole slew of different cells that can help repair and regenerate. So those are the ones that we want, because hematopoietic ones, which also are in our blood and are in some of our tissues, and a lot is in your bone marrow because your red blood cells come from your bone marrow, those don't really become any things like we call cartilage tissue. So those are not good for that. They're good for making red blood cells and white blood cells, but they're not good for becoming cartilage tissues that we can be functional with in our body, muscles, nerves, and things like that. Now, if we decided we want to use stem cells, we want to make sure where we're going to get them from. If you want to get them from your cell, from your body, that means you got to come in for a procedure. That could be taken from your bone marrow, and that usually happens from the iliac crest back here and the posterior celiac spine. So we stick, a bone marrow needle in there to extract stem cells. That could be a little uncomfortable if you've ever had that done.
Just hearing about it.
Yeah.
Yeah.
And most people don't look forward to that procedure.
No.
But it has to happen a lot in patients who have leukemia. This is done on a regular basis, and so
Wow.
it's not something that's not uncommon. It's done quite often, and we could use that. The bone marrow, though, doesn't have a high propensity to have a lot of mesenchymal stem cells. I call them mesenchymal or mesenchymal. It's kind of interchangeable, like tomato, but same type of cells. So it doesn't have a lot there. You get about, like for every cc of blood you drop, or 1 milliliter of blood, you get like maybe 10 million. But if I take it from the fat, I get 50 million. Okay? And I'm not getting hematopoietic ones, which I can't use for anything anyway, except maybe sending out growth factors, and they bring some of their cartilage, or not cartilage, but some of their hyaluronic acid, or tissue support scaffold. So, you got the blueprint, which is your DNA, right? And then you have the scaffold around that kind of protects and supports that DNA expression to become whatever you want it to become. And so that's what they provide. So when you take stem cells, you take a lot of products that come with them. So you're able to get hyaluronic acid, proteins, carbohydrates. You get things like exosomes. Those are growth factors. Multiple types of, let me be more specific. Exosomes are little packages, little balloons, we'll say, full of all kinds of growth factors that will stimulate your body to heal. Now, human to human, they're interchangeable. Mine work for you, yours work for mine, okay? However, your stem cells won't work for me, mine won't work for you, because they're specific for you. Your DNA is for you, okay? But I can take little pieces of that scaffold that we're talking about and get we call it messenger RNA and RNA, which is ribonucleic acid, the blueprints. And I can stick my blueprints in your DNA. And then I can change some of your cells to express what that RNA or ribonucleic acid is telling it to make. So that's the unique part about using products that have stem cells in them. Stem cells by nature, I can't transplant them into you from an umbilical cord blood, and they're going to take. They either make growth factors, exosomes, and dump there to heal and repair and send signals to your bone marrow, so your bone marrow makes more stem cells, it comes in and repairs it. Or it becomes part of the tissue. And I can't do that if I'm a donor. I can't do that for you. But we can use, unless I take your fat and transplant your own.
So thin may be in, but fat's where it's at, baby.
That's right. So if you lose all your fat, you got no stem cells to transplant that are effective. And in fact, there are some clinics in this country that specifically use your own stem cells. They extract them from your bone marrow, take them from your blood, and get them from your fat. That is an intensive process, and there's some pain involved, and it does cost you money to get it extracted and then re-inject it. Okay, but having said that, one would argue, okay, well, I get my own, so that's a good thing. Yeah, you get your own, but it's your age. It's your own age.
Interesting.
Okay. Now, if I get a transplanted one from umbilical cord, it's not my own, and it doesn't take, but it's got a lot of horsepower in it, because it knows it's going to have a short lifespan, but it's fired up, ready to go. It isn't 51 years old like mine is right now, and it's got a little bit of track on it, you know what I mean? So it's going to not be as effective. So there's something to be said about using umbilical cord blood, which is not hurting anybody. It's actually tissue that's going to be destroyed anyway. We can actually use it for something that may be able to help humans. And from all kinds of neurodegenerative diseases like Parkinson's, dementia, okay? We can use it for things like amyotrophic sclerosis, which is also called Lou Gehrig's disease, multiple sclerosis. Now, all those things obviously are under scientific research, and so there is no specific FDA clearance to use them for that, but they're doing studies on them, which means that somewhere down the road we're going to have a lot of information that supports it. Or in the United States of America right now, there's no indication for using those things, but in other countries I would say there is a different opinion. And we'll say places like China and places like the Caribbean, also places like Venezuela and other countries in this planet that actually are using tissues to help neurodegenerative disorders improve. And so they have different methods of doing it, although we're not doing it in the United States as of yet. In my practice, we do like joint repair. So we use stem cells for joint repair. So I may use umbilical cord blood, which I get from a donor, and I purchased it from a lab that has its testing on it for all kinds of specific diseases. And I have the rundown of what those diseases are, and we make sure the patients understand it. They sign a clearance that they want to use it. There are obviously some side effects of doing these products, and people always ask me, what are the side effects, doctor? You can have pain, bleeding, infection. Those are the commonest things. Sometimes people get a little bit of a fever or feel a little bit sick and ill because of the sudden response and your reaction of your body to the treatment. But in my experience, I've never had any adverse outcomes, okay? Nobody's ever gotten, severely ill, let alone died or anything like that. And there's not a supportive literature that supports that idea anyway. So it's very safe, and we use it all the time in our practices. Using your own stem cells bypasses the whole FDA thing. Although there's issues regarding that right now where the FDA is actually fighting that you even can use your stem cells on yourself because they're categorizing it as a drug even though they're your cells.
Interesting.
So there's some issues at play right now, and this is being debated all over the country. And so right now we're able to use a few different products. One other product that we're using right now is not a stem cell product, but it's a umbilical cord product that has no living cells. Okay, so when you have no living cells, you have all the growth factors in them, all the supportive scaffolding structures like carbohydrates, proteins, the growth factors, everything to help make what you're doing repair. And so we're able to buy those products which are acellular, we'll call them, or they have no nucleic or nucleus containing cells. Okay, so
I have a friend that lives in San Jose. She's a martial artist. I won't mention her name. She might not want her name mentioned, but I remember a few years ago her talking about getting stem cell therapy, and I think it was, she says, they take my blood and they shake it up and they inject it back into me. And in her 70s, she's still training, running around, so.
So let me comment on that.
Okay.
So when you take your blood, that's basically platelet-rich plasma you're taking, okay? Platelet-rich plasma has some cells in it, very few mesenchymal stem cells, a few hematopoietic stem cells, which are different blood type, right? Blood type specific cells that are going to be derived into blood cells, and then you have some mesenchymal stem cells that are going to become into tissue-specific cells. And then you have a lot of platelets which carry your growth factors. And the platelets, once you stimulate them, they release their growth factors because you ever notice when you get a lacer, or cut, say you got a cut, do you remember that first thing that comes is you get this little clear, like, plug there? That's your platelet plug. And the whole goal behind a platelet plug is to stop the bleeding, number one. But guess what it does also? It releases all these growth factors. You actually get a stimulus to repair the tissue. Because how do you think it repairs itself? Because the platelets send growth factors out, which send basically signals back home for your stem cells in your own body to come and fix that. That's how it works. So it works good for things like skin, but it doesn't work really good for other tissues, other organs, and that's why we stimulate them. And so, like for instance, your friend, like platelet-rich plasma, I use all the time for things like hair growth. You get some stem cells, but you get a lot of growth factors, and that helps people's hair grow back. So I put it in their hair. I sometimes use it for joints like knee injuries because you can get about maybe 3 or 4 months, maybe longer sometimes, of healing or less pain just by taking the growth factors out. Taking the blood, concentrating it down, filter out the platelets, and you can tell by when you separate out the blood when you spin it on a centrifuge, and then you basically compress it one more time, and then I use a special device called an Adolite, which uses different frequencies of light, which photoactivate the platelets so they open, they burst, and they release their stem cells, or not stem cells, but their growth factors. And so I do that, and then I inject it where I want to go. And usually you get pain relief, you get better movement, and you get some repair of what's been damaged, and patients usually do well for some time. It just depends how often you do the injections, and it does do better. There's also other treatments out there where people take a lot of blood out of their own body, and they're able to take the platelets out and get a lot of blood. I'm talking like about 100 milliliters of blood or more. And
I
they're
don't even
able,
like a little bit.
well, you know, it's like you just don't look at it, and you got a lot in you, remember. But we're able to take a lot of blood, and that's relative terms when I say that. And you're concentrated down to maybe, 20 milliliters of concentrated platelets. Well, I can get that, and I can mix it with a little bit of calcium chloride or some thrombin, and I can get all the platelets to basically coagulate, and then they release their growth factors out, and I'm able to suck that out from the platelet plug that's in the middle of my tube, and I'm able to get maybe 12 to 15 milliliters of really concentrated growth factor fluid that doesn't have anything, and then I run it through a special filter in the office, and then if I have an IV in you, I can put that growth factors back into your blood. What's the advantage of that? Hey, you just got a massive release of growth factors into your blood to help heal tissues. Now, the first pass is always going to go to your lungs and your heart, but there's always a lot of damage there going on from just living. But something's going to get out of there, and it's going to go to the other side. It's going to go up to your brain, go down to your kidneys, go down to other organs. And the idea is that, some people do this on a regular basis.
Wow.
And they do it on a regular basis, and they get basically self-donating growth factors for repair. I don't do that just because it seems it's a lot of work to do it, and most patients, to market that, you'd want to do that on a regular basis, and that's okay. I could do this if I wanted me to do it, but that'd be the only way that we're allowed to do that in the United States, to give growth factors back to yourself through intravenous. Okay, we're not allowed at this point to do any type of stem cells IV. We don't market that stuff either. Now you can, and using it for specific joint issues and things like that, you're using typically acellular products. They don't have living cells, although you're able to buy them. There's just an FDA, a statement that kind of says that, stem cells there's not an FDA clearance to use them, but, I have, anecdotally, and there's a lot of research supports what I'm saying anecdotally, you have a lot of patients that really do tremendously well with stem cells, with platelet-rich plasma, whether you're getting stem cells from yourself or you're getting them from a donor that you're purchasing from umbilical cord blood that's been cryopreserved. Either way, for the most part, when we use them in a typical office setting, you're going to get about a 90% response rate. Is typically what I've seen, and that's consistent with the literature. So, joint pain improvement, you can actually take X-rays. And take X-rays 6 months later, you can actually see the joint space has improved, has increased slightly. So when they tell you that stem cells don't become those tissues, well, if you're using your own stem cells, or if you're using a lot of growth factors, and you're getting a stimulus that's bringing in your own cells, well, the idea is supposed to be repairable. It's supposed to be repairing and growing it. So why wouldn't you get some improved tissue? So this is one particular product that we use. There's dozens of companies that use this. I've used this particular company, and they have a very good product. Although I don't sit around and endorse anybody because there's a lot of good companies out there. When you're looking for products that have a good sterile prep procedure, good guidelines, and help you walk through and hold your hand and walk you through the whole process, this is a very good company that does support you in that response. And there's a few other ones out there as well. But they both can provide you living stem cells, and people always ask me, well, how can they be living if they're coming cryopreserved, doctor? Well, the fact of the matter is they do. So when you thaw them out, actually by rubbing them in your hand for about 5 minutes, you're actually able to see about a 70% revival rate. And people, 70% sounds bad. Actually, that's very good. That's very good. And when you're buying, you're ordering these products, you're buying 15 million, say, for a joint, or 10 million for a joint. You get a 70% survival rate, you're going to get a good response. And we can do quite a bit with the multipotent mesenchymal stem cells that we have available in our own bodies, and then we're able to get it from umbilical cord blood. So the future is very bright in that regard. And so the idea that we can't do enough with what we have, we can do a whole lot of stuff. It's just that you have to be creative, and given enough time, humans are capable of just about doing anything.